So today we're going to talk about boils. Yeah? So some people call them Furuncles, others call it skin abscess. So here in our local language, I think people call it killer V, other people call it edute. So I have a brief story about that. So for me, I've studied in boarding section like since my primary. Yeah? So I used to sleep down. Yeah? And there is a colleague of mine during my primary level. Yeah? And there is a colleague of mine who used to sleep up. So this guy used to bedwet, and during he used to pass through that guy's mattress, yeah, like till my bed. So I used to wake up in the morning when I'm in typical urine. So I used to run to class. Like I used not to want to bathe in the morning. Other people used to bathe in the morning. So for me, I used to run to class. So I got those boys. So I used to fear this guy, and I used to and like I was fearing reporting the guy to the warden such that they change him, yeah, so that they put him in another bed, yeah. So like most cases I got those boys, and I used to go to the sick bay, and other colleagues of mine used to have them. But there is one friend of mine who used to bathe well. So this guy used to wake up very early in the morning, and the guy used to bathe very well, go to class. So this guy never got boys. So like here in our local people used to think that people who used to get boys are those people who used to bathe wet every day. So I was asking myself, why didn't this guy get boys? So today we're going to talk about those boys. Firstly, a boil is a painful pus-filled bump under the skin caused by uninfected hair follicle. Yeah? So boils are commonly caused by bacterial infection. Yeah? So the bacteria is called Staphylococcus aureus. Although there are some boils which are caused by bacteria and fungi. Yeah? So boils usually start as reddish tender bumps. Yeah? So these bumps quickly fill with pus, like growing, then they grow larger, and then they become more painful until they rupture and drain. Yeah? So boils can occur anywhere on the skin, yeah? But they appear mainly on the face, back of the neck, armpits, thigh, and buttocks. Yeah? So the areas which usually have hair, yeah, on them. Yeah? So these areas, like, they commonly sweat and experience friction. Yeah? So that's where boils most cases happen. Yeah? So what exposes you to boils? So the first one is poor hygiene, like not washing the skin properly, especially in areas, yeah, which have hair and sweat. Yeah? So these areas, if you don't wash them well, yeah, like you increase the risk of getting that bacterial growth, yeah, which leads to a boil. So the second one is skin conditions. So if you have skin conditions like eczema or acne, you're at a risk of getting boils. So the third one is sharing personal items. So we used to share a lot in our primary level, like sharing towels, sharing razor blades. Yeah? So that one puts you at a risk of getting a boil. So the fourth one is poor nutrition, like a diet lacking essential nutrients, yeah, like which can boost your immune system, yeah, also puts you at a risk of getting a boil. So the fifth one is obesity, like excess weight can create skin folds, yeah, like these skin folds, like you start sweating from those folds, and then after you get some bacteria which can accumulate, thus leading to a boil. So what are the signs that you might be having a boil? What are the signs? What are the common signs? What are the symptoms that show that you might be having a boil? I know you're asking yourself that question. So the first one is a painful red bump that starts out small and in most cases it enlarges. Yeah? So the second one is a reddish swollen skin around the bump. Yeah? So if you have a reddish swollen skin around that bump. So the third one is an increase in the size of the bump over a few days, like it gets filled with pus. Yeah? So the fourth one is development of a yellow-white tip that eventually ruptures and allows the pus to drain. Yeah. So what's the home care? What can you do when you get a boil at home? Like, what can you do? Like before going to hospital? First of all, warm compress. So when you get a boil, you should apply some warm, moist compress. Yeah. Like several times, like a day. Like on that boil, apply it very well. So the second one is keep the area clean, like keep it clean. So after the boil starts draining, keep it clean, yeah, and continue using warm compress. Yeah. So the third one is change bandages often. So if they have put their bandages, you should change it. So you don't leave like a one bandage like for very many days. Yeah, you should change that bandage. So the fourth one is resist the urge to squeeze the tip. Like some people want to pop everything, so you want to pop it. So resist that urge which pushes you to pop it. Yeah. So when to say doctor, when you have a bump. So when do you go immediately to the doctor when you have that boil? Yeah? So the first one is when the boil is very large and painful, you should run immediately and see a doctor. So the second one is when you have fever, you should run very fast to a doctor. So the third one is when the skin boil is located on your face, yeah, or near the spine, yeah. So the fifth one is when you have diabetes. Yeah? When you have diabetes, you should go immediately to a doctor so that you receive treatment. So what can we do to prevent these boils? First of all, maintain good hygiene. Like maintain good hygiene. You know what they call good hygiene. Like wash your hands with soap, shower or bathe regularly. So that's how we maintain some good hygiene. Like wash your clothes. Yeah. So the second way is keep your skin clean and dry. Yeah. So the third one is avoid sharing personal items like razors, towels. So the fourth one is boost your immune system like through eating a balanced diet. Yeah. The fifth one is treat underlying conditions. Yeah. Yeah. Thank you very much. That was my submission about boils. So for any question you can ask in my comment section, or you can send me a question directly. So thank you very much for following me up. Thank you very much for liking my videos. I appreciate.